Assalamu alaikum. Welcome to another Wellbeing Wednesday, where this month we're going to be talking about refugee, mental health and wellbeing. Now I'm joined by Doctors of the World. We're collaborating with them this month, which is incredibly exciting. And for the first time ever, actually, we've got two guest speakers. So I've got Dr. Yusuf Ciftci, who's with Doctors of the World. He's their policy and advocacy manager, and he has a PhD in politics and international relations. I'm also joined by Dr. Niloha Rangel. She's a medical doctor who's specialising in family medicine, mental health and emergency care. She's a national health advisor at Doctors of the World. So not only do we have lots and lots of experience from them, but they are also refugees themselves. So they come with lived-in experience as well. So I'm actually really, really privileged and delighted to have you both today. Welcome.
Thank you, Fawziya.
Thank you very much.
So I guess not everyone may know what Doctors of the World do. So would you mind just kind of giving a bit of an overview of what your organisation does?
Of course. Yeah, thanks again for inviting us and collaborating. So Doctors of the World is a medical charity which provides clinical services and advocacy services for people who do not have access to mainstream health services. So it's part of an international network that is called Medicine du Monde, but we work in the UK chapter, so we are working based mainly in the UK. We have some clinics. In the clinics we have volunteer doctors, nurses, and medical students who are providing healthcare for those who do not have access to healthcare. But the main purpose of our clinics is actually help them to register with a GP, so help them to have that mainstream healthcare for the NHS. We also run advocacy programs to inform policy and practice. We run Safe Surgeries Network to support GP practices. So this is the other side of the work. So in the clinic, we support patients, and we also, with the advocacy program, we support healthcare professionals. Another project that we are working is a co-production project. It is working with people with lived experience like us, like Niloha, like me. So that project is aiming to achieve a meaningful engagement with people with lived experience of health exclusion and immigration, UK immigration system. And what we aim to do that in that project is actually we deliver trainings to other migrant groups, or we inform the way that our services run. The policies and the campaigns are run at Doctors of the World. And also we try to capacity build in the NHS and public health in England. So Niloha and I am working as in that co-production project, and we call it National Health Advisors Project. So that's why Niloha is one of the members, and I'm so glad to be working with so many different national health advisors in that project. So that's just kind of a recap of the organization and what we do.
And it sounds like you're doing incredibly important work. And you mentioned a few words: refugee, migrant. You know, when I think about those words, asylum seekers, refugees, migrants, I think about certain tabloid narratives. I think about, you know, the way the government might spin those words, or how some certain media personalities, there's quite negative connotations around those words, and that can be quite unhelpful in itself. So I thought it would be really useful if you could just educate us. What do these words actually mean? What is a refugee? What is an asylum seeker?
Well, good afternoon. I am a refugee myself. I'm a medical doctor, actually taking exams, but to be able to work in the United Kingdom as a doctor. So an asylum seeker is a person who has fled their country because they were at risk of serious human violations and persecutions there. The risks of their safety were so great that they felt they had no choice but to leave and seek safety outside their country, because their own government wouldn't or couldn't protect them from those dangers. So an asylum seeker is someone who is seeking protection, but whose claim has not been determined. In contrast, A refugee is someone who has already been recognized by the 1951 Conventions of Refugees. In other words, refugees have already the right to international protection. I will pass on to Yusuf, who can explain some more details about it.
Yeah, so as Niloha said, you have to be in another country to apply for asylum, for international protection. So the moment you arrived in another country and let the authorities know, you become an asylum seeker. And then that country will decide on your case. And if they believe your case, then they will give you the refugee protection, which is in line with the 1951 Refugee Convention. But obviously, the system is quite complex. So it's not an easy process to actually seek asylum. In most cases, it takes years for asylum seekers to get refugee status. And also in some cases, the Home Office in the UK or the authority in countries, they refuse the application. That's where it becomes really complicated, because you will have a right to appeal, and then you will go to the court and there will be a court hearing about your case. But at the end of that court hearing, then the decision might be that yes, you are given a refugee protection, or no, actually the court might not believe your case is genuine, and actually you might be refused asylum seeker. In that situation, you are simply being asked to leave the country because you don't have a right to live in that country. But it's very difficult for many people to actually do that, because asylum system, when you actually try to apply for asylum, you need to provide strong evidence about your case. And it's oftentimes not easy to provide that evidence because people do not actually prepare to go to another country. They run from conflicts, they run from persecution. So that's often the case people are put in. So that's why we use actually the term migrant when we talk about refugee and asylum seekers, because migrant kind of captures asylum seekers and refugees as well, and all the different processes. If it is for example, a refused asylum seeker, then they are still migrants, but they are called undocumented migrants, for example, or refused asylum seekers. So it's very important to actually know these terms and what it means to be an asylum seeker or refugee.
Absolutely, and I think sometimes those words can be used interchangeably, and as I mentioned before, that there's sometimes some really negative connotations coming from media, the government, etc. You said something which really kind of I really felt it there when you said people don't, they're fleeing their country, they haven't got time to kind of document everything. Of course they haven't. So what sort of things, what sort of difficulties, what sort of traumas have people gone through when they were in their home country? What sort of things have been going on for them to want to flee in the first place?
Well, some of them have faced persecution or a reasonable fear of persecution due to his or her race, religion, nationality, membership into a particular social group, or just political opinion. Others might have experienced trauma, violence, including exploitation, torture, or sexual and gender-based violence, or just come from war or civil war, where they have suffered violations of the human rights, or some others just environment and climate issues or economic hardship. But it is important to note that most of the refugees and people seeking asylum will displace within their own country or will reside in the neighboring countries if it is safe to do so, or even return to their countries when the situation improves. So that will be the main issues that could have made the decision to migrate or just flee their countries.
And I can also add that these difficulties and traumas are not actually only from their own countries, but the process of migration can create so much difficulties for people, including, health problems, health issues, and mental health issues as well. And their experiences and socioeconomic conditions at the host country can also create or really make it worse about their mental health situation. So we know that seeking asylum, in order to seek asylum, you will need to go to another country, but you don't have visa, you don't have any documents. So the way for you to do that is actually use irregular methods of, travel. We know that it's not actually from their home country, but the experiences of those journeys, especially, for example, you can think of the situation in the Mediterranean, in Greece, in hotspots, people are trying to cross the borders in very dangerous situations, and that actually creates further mental health issues among many people. People, remember those memories later on, and once they arrived in the country, it feels like they found safety, right? It's supposed to be a safe environment, but then again a process starts there. You need to apply for asylum, you need to speak about those memories, which are really traumatic memories in most cases. You need to tell them, you need to make them believe that you have a genuine case, and so that they can give you a refugee status. So many people really relive those situations when talking about those situations. And if the community, if the society is not helping them out to facilitate their integration and cohesion with the community, that's when actually we see really further problems about people's mental health conditions. I will give one example. In the UK, there is a no-choice dispersal policy. So once you come to the UK, you apply for asylum, Home Office is providing you an accommodation, but you don't have any choice of where to live in that accommodation. If you're applying for accommodation, you will be sent to somewhere based on no choice. So you might be sent to Wales, you might be sent to Scotland, you might be sent anywhere in England. You don't have any choice on that. And that actually really uproots people's connections with the local community, because you are sent to somewhere, and that's called initial accommodation, and you spend some time, maybe 3 weeks or a month normally. With the COVID-19, it's actually taken months now. And now you are sent to a dispersal, a long-term accommodation. So people start making connections, social connections, and then they are again uprooted to another location. So just this simple policy, but it has huge impacts on people's life and their well-being.
Absolutely. I'm hearing, not only have they got their host countries' difficulties that they had to face, then the perilous journey to get to a safer country, but when they arrive, actually there's just even more red tape, more barriers. I was wondering if you could maybe talk us through maybe a typical journey of when someone does arrive. What do they have to go through? So I assume from my experience when I've been dealing with patients with mental health difficulties after being a refugee and asylum seeker coming into the country, they talk about the detention centres, they talk about no recourse to public funds, which is very difficult from my end to try to treat people because then they can't pay for their medications. And you've touched on things as well, Yusuf, about kind of constantly kind of moving around, no kind of settled status. I was just wondering if you could give a bit of an overview for our viewers.
Well, it's not only that, when you hope, you believe that when you arrive, you will be shown how to access services, healthcare, English support, but this doesn't happen. So you struggle with language. So language would be the main challenge you have to overcome. So the UK does not provide a standard and mandatory induction program for new arrivals. So asylum seekers need to acquire knowledge about studying, working, integrated into a community in the UK from existing networks or just by word of mouth. So there is a lack of support for integration and the pathway to follow. So you are also not explained that where you are going to live, what sort of accommodation, you know, and also what things like you could volunteer, you can go to ESOL classes. So all these issues, you start realizing these things later on. So other barriers, apart from the ones you just mentioned, is secondly, would be the right to work, you know. It's during this complex asylum process, you are not allowed to work, whilst your claim is to be decided. So this can take months or even years. So asylum seekers are not allowed to work, so they are trapped on £5.66 daily, which obviously is not enough to pay your expenses. And also you are given an Aspen card where you can just withdraw money, you know, because this card is not contactless. So let me give you an example. For example, during lockdown, the buses wouldn't accept cash. So you couldn't take a bus because you don't have a contactless card. So, and also if you wanted to shop your groceries online, you know, that was kind of a limitation. That's another barrier you are facing. And obviously you cannot have open a bank account. So you feel that there is a lack of the opportunity to develop your independent skills. So you feel like a burden where you could be contributing to this economy or even pay taxes. So during this time, people seeking asylum are provided with basic accommodation on a no-choice basis. So you can be living on you can be living in very poor living conditions. Another barrier would be that your skills would be wasted, and it can be years of waiting. And so refugees lose years as their qualifications are not recognized. So some of them have to retrain. So there is like a prolonged uncertainty and fear about the future. Those are the major factors. Of course, they will exacerbate the effects of your trauma of just fleeing your country, the dangerous journey maybe you went through. So, and sometimes asylum seekers live in ghettos, you know, so it makes it so difficult to integrate into this community. And other factors that are worth mentioning is, for example, communicable diseases, they are not treated. For example, what about TBC or HIV or others? It's important to offer a screening on different infectious diseases because these kind of diseases can be very common in countries where refugees have spent time before coming to the United Kingdom. And so it should be mandatory to find out what vaccinations refugees have, and in order to let them receive them, so to vaccinate them, to protect them, and also to protect the community. Some of the other health issues that worries us is that sometimes there is no control of your chronic conditions. So that's another concern, because when you arrive in the United Kingdom with poorly controlled chronic conditions, such as diabetes, hypertension, mental health disease, or to just you are out of medication. And let's say, for example, you are pregnant. Well, that's the first contact a female asylum seeker have with the UK healthcare system. But there is a huge concern because the food that is given in the food banks is lacking of nutrients or proteins, you know, just to while you are pregnant. And another factor that for me is really important is that we are not screened on mental health. So when some of us can suffer mental health related to the reasons why we have to flee the traumatic journey, or just the integration into a new country, because you have to start your life from scratch. Plus the worries of accessing vocational work, education, training, employment in the United Kingdom. So it's not only the first challenges you have to overcome, is all of these things affect asylum seekers and refugees. So to sum up, some of the barriers you just face is language barriers, cultural differences, poor living accommodations, prejudice, isolation, and lack of employment, difficulty to qualify your previous degrees, and this small allowance that you know that is not enough to eat. And also racism, discrimination, and so we know that this asylum experience or process has a detrimental effect on health and well-being. So I just will pass on to Yusuf to explain a little bit about how dangerous or how challenging is to access medical services.
Thanks, Niloha. Yeah, I mean, you explained the why there's barriers, layers of barriers for people in their life, talking about right to work, to the food and everything. But I wanted to say really kind of some systemic barriers to actually access to healthcare for refugees, asylum seekers and migrants. As you said, Niloha also mentioned about the language barriers and wider problems about not knowing actually what to do and how to access the services is number one barrier, really. Many people have, a different health system in their own countries. So when they come here, it is very difficult to what they are used to. You will need to register with a GP, you will make an appointment, and sometimes it can come like maybe 3 weeks time. It is busy in primary care, we know that. There are some certain procedures that you need to follow like everybody else. But many people are not familiar, in their home country. They might just maybe turn up and they might get the healthcare. So there are some, unfamiliarity with the NHS system, and yeah, it takes time for them to get familiar, or further resources and support and induction, as Niloha said. But at the moment, we see so many different systemic barriers. For example, accessing and receiving primary care is free, and everyone is eligible to do that, regardless of their immigration status. But we do see that many GP practices are asking for, proof of ID, proof of address, passports, immigration documents. They tend to ask about, how did you come to this country? This shouldn't be the case, because it puts people off from registering with the GP. So it is a barrier that we see in our clinics at Doctors of the World, that many people are not able to provide proof of address because they are in a vulnerable situation. They are, homeless, or they are actually, changing places from time to time, from friends or to other contacts. But they need to see a doctor, but they can't see it because of these barriers, and that's quite important. Immigration checks, for example, we know that in primary care, immigration status is not relevant because everyone can access it, but there are still so many questions around that. Niloha mentioned about that, but the problems about accessibility, language barriers, digital barriers, or even physical barriers like transport. These are all barriers to access health services that many migrants face, including people who are refugee asylum seekers. There is a bigger part of discussion is actually trust issues to the authority, to the NHS systems, and that comes, follows up quite nicely with what Niloha said about racism and prejudice. We know that there are trust issues to the NHS among many migrant communities, and I know personally from my experience of seeking asylum, and that's because the immigration system creates a platform, an environment where you felt that you are monitored, and you are actually, you need to report, you need to kind of provide all the IDs and everything to everyone. And that's like a danger zone for migrants, that people do not want to go into that danger zone. And they felt this danger zone when they are actually asked questions at the GP practice, when the receptionist asked them about your proof of address, without that we can't register you, or your immigration documents. So I know, for example, during the asylum system, every 2 weeks I had to go and report to immigration officers. That seems like a simple process, right? Every 2 weeks you go and see an immigration officer, sign something, and then go back. But the weekend before that, the 1 or 2 days before that was not good for me. I always felt nervous. I developed anxiety because I'm gonna go and see someone about my immigration status here. So that creates a fear of authority. I passed that, but there are many people who are in this situation. They develop fear against authority and the NHS. So they do not want to go and register with a GP because they think that their data might be shared with the Home Office, and the Home Office can come and detain them or deport them. People do not want to go get the COVID-19 vaccine because they think the same. They think that if I get the vaccine now, Home Office can track me, and they can find me, and they might deport me. And this is because every asylum seeker is considered on bail, which means that they are not detained, but they're on bail. And this is with the current recent changes into the Immigration Act in 2014, which came into place in 2016. So these bail conditions are really kind of making it difficult for people to, access to education, access to health, access to banks. Even if you are gonna rent a place, landlords are able to, and within the law, they are able to ask you your immigration status. So these are the situations where actually people find themselves in, which makes them really difficult to build a life in this country.
It just sounds like, at every point in the system, it's traumatizing, re-traumatizing, such a lot of uncertainty, unsettlement. I can't imagine what impact it must have on people's mental health. Obviously, in my clinic, I do see patients with mental health consequences of their journey. But I was wondering if you could kind of expand a little bit more. What sort of longer term well-being, mental health effects do you actually see?
Well, relating to mental health, people should know that we are witnessing a mental health catastrophe that will affect most of us and will change our world, because this is a phenomenon that will not stop due to globalization and the current migration. So the most common mental health diagnoses associated with refugee populations include a post-traumatic disorder, major depression, generalized anxiety, panic attacks, adjustment disorder, amongst others. But the incidence of this diagnosis varies with different populations and their experiences. But the psychological toll is immense. I was revising the figures, and we know that 19% develop anxiety disorder, 41 depression, 61 post-traumatic disorder, and 21 signs of suicidality. So if we put this in perspective, a return and comeback veteran will suffer 10% post-traumatic disorder. So refugees suffer 3 to 6 times more post-traumatic disorder than a soldier returning from war. That's incredible. And so post-traumatic disorder is a condition that is caused by a traumatic experience. So the symptoms we see amongst refugees and asylum seekers include flashback, nightmares, feelings, they feel very anxious, they have difficulty sleeping, sadness, even hate. and they might feel, some of them, detached or estranged from other people, because they're trying to find stability in a place where you just feel like an outsider. So people with post-traumatic disorder have intense, disturbing thoughts and feelings related to their past experience, their journey, or even after the traumatic event has ended. So that's worth noticing. And children and adolescents refugees, they account for more than half of the world's refugees. They have a higher prevalence of mental disorders than children and adolescents who are not refugees. So some of these are just attributed to war experiences, to stress during their transitions, such as detention, post-immigration stressors, or acculturation difficulties. So it is important to know that every sort of transportation carries different sufferings, worries, and traumas. And one of the things is that this is a golden hour. This is a short time where we can change the story, and we will tell ourselves for the rest of our lives. So as a result of this, we can reframe our memories, because refugees, they don't have only lost their lives, they have lost their souls, their mental health, due to this cruel and traumatic experience of fleeing or during the journey. So I believe that this is a story of bravery, and but the idea is that we can reframe the trauma and establish a new narrative. And because, you know, first aid, like shelter, blankets, food, banks, is just a band-aid, and it's just for the body. But we have also have to include the mind, because the impact on the soul is hardly visible, and the damage is going to be there for life.
Well, actually, I did want to ask, you know, when I'm in my clinics, it's quite difficult to signpost where a lot of my patients can get that wellbeing and mental health support. Some of the reasons which you've kind of mentioned about language barrier, there's also cultural differences. You know, does the therapist actually understand the trauma and the difficulties that they faced in their host country, in the migration system, coming to this country? Then, of course, they're quite a nomadic population. So by the time we refer and they get accepted, they might have been moved on to another accommodation. So there's lots and lots of barriers, which personally I have seen with my patient cohort. I'm just wondering what sort of practical support and advice would you give for these people for their well-being and their mental health?
Well, when you consult your GP, you are just given tablets, and in few occasions, talking therapies and counseling. But this is not the rule, and sometimes the follow-up might be in 3 or 6 months, if there is one. But you need like a daily reinforcement that everything's okay and you're gonna pull through. So it is important to comprehend that no matter the reason or how dangerous was the journey, but just the fact that you have to flee your country and leave your loved ones, your house, your job, your friends, your traditions, your customs, your whole life is enough to suffer a mental health issue. So you need a closer approach from your GP. So I believe that apart from medication, but sometimes it's not really necessary, I counseling, just someone who you can talk to, you know. And I believe that between ourselves, we have to play our part on trying to cope with difficulties. So I would like to share the way I decided to cope with my migration. I realized that I came to realize that I had to find a purpose in this community. And I mean, what was my dream job or what I wanted to do? So I just decided to achieve my goals and work consistently. And because you'll be amazed how powerful you are and how you can impact the world and the people that is around you. So in my case, I started volunteering with TCC, that is a charitable organization together creating communities. So a group of us, asylum seekers, we started to deliver trainings in the community to teach the people from this town how to welcome refugees and embrace diversity. So that was fantastic. And we had such a wonderful feedback from the organizations which attended. And so, and also I was given the opportunity to attend an event in London for the right to work. That was part of the, you know, the help they were given to asylum seekers. I also joined Voices Network, where I just met Yusuf. And well, in this charitable organization, well, we just try to humanize asylum seekers and refugees. And because we have realized that our voices are powerful and we have a place in culture, we can impact culture. So we attended a training called Sanctuary in Politics, where we learned how to campaign, how to advocate, and raise our voices. I also joined different organizations. So they gave me the opportunity to speak out on the radio, the local newspaper, just to raise awareness and speak for the voiceless. I also made videos and delivered presentations for Town Sanctuary, Cardiff University. So spreading my words, it was just spreading my words between my community about well-being and having a healthy lifestyle, how to cope with difficulties while you are during this process, and how to be resilient. So doing all this, without knowing, I just was shortlisted as one of the most influential women in North Wales. And but if I win this award, oh, that would be amazing. But if not, you know, I felt valued by this community and I found my place in this country. So I believe that every refugee should not only wait to receive counseling because we know how this works, but you should find a purpose while you are waiting for your asylum to be, your claim to be determined. And well, one of the most recent projects is we are launching a podcast, and where we are going to tell our stories, and we are raise our voices and let people know why we fled, why we are here. So this has helped all of us to cope with our mental health, because we feel a part of this community and we feel embraced. And of course, I also volunteer with Doctors of the World as part of National Advisory Group. So I believe Yusuf is going to explain the wonderful job we do at this organization.
Yeah,
Thank
just
you
to
for sharing your story as well. I think a lot of people find that so helpful listening. I know I certainly did. Sorry, Yusuf.
no, that's Niloha's story is just amazing. The things that Niloha has done in so many different projects, charities. Now that she's been recognized for this award, like that's what we need to tell people. Refugees are not refugees, who are just receiving supports, benefits, and consultation, medicines, as Niloha was saying. Refugees are agents. They have power. It's just that you need to untap that power. You need to provide a suitable environment so that people can actually go and do whatever they want to do, have a sense of purpose and do things. And I would like to touch on co-production projects, the community-based projects that Niloha have been mentioning. I think co-production is essential in ensuring that there is an equal partnership with refugees in any projects. You can do a volunteer in any organization, but at the end of the day, you will need to feel empowered. Some voluntary roles, that's completely okay for you to learn new skills. But we have been trying to put co-production in the work, which means that when you are doing things, you have the control on that thing. For example, in National Health Advisors Project, we use co-production as a principle. And we said that let's deliver the training to migrant groups, and we sit down on the table as equal partners. So there is not doctor software people and the migrants. There is National Health Advisors Projects. Everyone is equal. And we start developing the guidance, developing the resource and the training package. And then we decide how to actually deliver this and what would be the best way to actually start the conversation and what kind of practical tips we should give people. And this is done in an equal way, by migrants for migrants. And that's, I think, is essential in really getting the services or anything that you do user-centered, because people have the power. And if you put people at the center of what you do, then you would make the best impact on the community, on refugees, on migrants, on everyone. So I would really suggest refugees, migrants, but also organizations in the sector to follow the co-production principles to the extent that they can do. The engagement should be meaningful to the in a way that refugees can also take things from it and build on their own career, because they're in a different country now, so they will have to build a new life, and to do that they will need these safe platforms to do that, these organizations, these projects. So yeah, I just want to highlight that really meaningful engagement is key, because we're not giving power to refugees. They already have the power. It's just that create that environment so you will see that they will thrive, not just survive.
Thank you both. I have to say that, at times there were some kind of sobering thoughts just thinking about the adversities that people do go through. But I'm so glad that we ended on talking about strengths, which absolutely, there's so many strengths that the community has, that they're bringing so many positive contributions to their new country. And I think that is also really, really important for thinking about their future well-being, their future mental health, and their purpose in this country. Thank you so much. It was such a privilege to have you both talking not only from kind of, yes, a policy point of view, but also the lived-in experience. What are the actual difficulties, the stories that I'm hearing that people are going through? I think that's the part that's kind of missing often in the narrative. So it's really, really humbling to have you both here today. Thank you so much. And for those of you who want to find out more about Doctors of the World, we've linked their website below. They do have some stuff on well-being and mental health as well, if you wanted to have a read. But in the meantime, thank you so much. Take care. Bye-bye.
Thank you.
Yeah.
Bye.